much caffeine do you consume in one day? 1, 2, 4, or even 6 cups of coffee, pop, or energy drinks? Caffeine is a stimulant of the central nervous system and the most commonly used drug in the world today. It is used to create wakefulness, alleviate fatigue, and improve concentration and focus. Caffeine is in some foods naturally. Let's see where caffeine comes from. A brief history of caffeine. Caffeine is an alkaloid occurring naturally in some 60 plants, of which cocoa beans, koala nuts, tea leaves, and coffee beans are most well known. Caffeine is naturally in coffee, tea, and some foods. It is often placed in energy drinks and soft drinks by manufacturers. Seeds of trees are roasted for coffee, while some caffeine comes from plants as well. Now that we have a brief history, let's look at some uses of caffeine. According to medicalnewstoday.com, in the United States, more than 90% of adults use caffeine regularly. The FDA considers caffeine to be both a drug and a food additive and recommends a maximum of 400 milligrams of caffeine a day. In the PowerPoint, there is 95 to 200 milligrams in one 8-ounce cup of coffee. 35 to 45 milligrams in one 12-ounce can of a soft drink. 75 to 150 milligrams in one 8-ounce energy drink. 14 to 60 milligrams in one 8-ounce cup of tea. Decaffeinated cola and soda drinks contain no caffeine. However, decaf coffee is not caffeine free. There is 7 milligrams of caffeine in decaf coffee. Caffeine is a common ingredient used in medications for headaches because pain relievers work much better with caffeine in them. Patients can take less medications. Caffeine additives make pain relievers 40% more effective. By adding caffeine and taking less medications, the patients reduce the risk for more side effects and reduce the risk of habitual and addictive use. Now we can look at the effects of caffeine on a person's body. MedlinePlus.gov reports caffeine can have some negative effects on the body, but most seem to be short-term. Caffeine can have a negative impact on pregnancy, fertility, glucose control, and other aspects of your health. It can increase the release of acid in your stomach, sometimes leading to an upset stomach or heartburn. It can increase your blood pressure, and within 1 hour of eating or drinking caffeine, it reaches a peak level in your body. If you eat or drink too much caffeine, it can cause restlessness, sleepiness, insomnia, headache, dizziness, rapid or abnormal heart rate, or anxiety. Since we have discussed the effects, let's talk about the benefit. The benefits of caffeine seem to outweigh the effects of caffeine. It can boost weight loss or prevent weight gain, possibly by suppressing the appetite and temporarily reducing the desire to eat. A 75 milligram service of caffeine can increase attention and alertness. A 160 to 600 milligram dose may improve mental alertness, speed, reasoning, and memory. Research has found that lifelong caffeine consumption may reduce the risk of developing Alzheimer's disease, and people with high coffee consumption have lower risk of having Parkinson's disease. Let's review what we have learned about caffeine today. We went through where caffeine comes from, the many uses of caffeine, and the benefits as well as the short-term effects that it has on our body. I hope that you will now be more conscious of the caffeine that you consume with the effects that it has on your body. Some may not realize all of the effects of the caffeine that it has on their body, as it is not found that it will cause cancer or a terminal illness. However, with the research that I have found, some of the effects, although short-term, are not worth the taste of that extra cup of coffee. I don't know about you, but I'm going to be more aware of my caffeine intake.